I have gotten the best treatment from this city that I could ever ask for.
And people have become just a little bit more comfortable with taking HIV tests.
We're trying to find things that are important for the person and giving them reasons to change.
There's plenty of people in the community who are surviving and thriving with HIV.
She said, if you take this medicine, you're gonna get better. And I believed her.
I thought I'd be a leader for everybody that lives in my building to go get the test.
And he said, I need to get tested, but I'm terrified. And I just said, it's okay. Everyone's terrified.
Years ago, I decided I better get tested for HIV. I had read about HIV being sexually transmitted, and I had been active. I was surprised to learn that everybody between the ages of 13 and 64 should be tested. Well, I was scared, but knew it was the right thing to do. I was lucky. My results came back negative.
It is estimated that 1 in 5 people who are living with HIV don't know they're HIV positive. There are close to 50,000 new HIV infections in the U.S. each year, and studies show that there are many people with HIV who use and abuse substance or face mental health challenges.
If you're like myself, you probably don't know where to start or how to get tested. You are not alone, and I'm here to help.
HIV testing is as easy as ever and is offered to you at no charge. The Chicago Department of Public Health encourages clients who receive mental health and/or substance abuse treatment services to get tested for HIV.
Hi, I'm David from the Chicago Department of Public Health. We work hard to make Chicago the safest and healthiest city it can be. This means making sure that there are testing sites available in neighborhoods across our city and that there's a full support system in place to provide assistance when you need it. You should never feel alone in dealing with HIV.
Being young, healthy, and what I thought very smart, I didn't see the need to be investing over $300 a month in private health insurance. I was very fortunate at the time because a young intern pulled me aside into an office and he said to me, "You didn't hear this from me, but if you call this number, you can get the help you need." And it was the number of the Chicago Public Health Service. I have lived with it now for 16 years. There is an accounting, a hard period to go through. The wonderful thing about it now is that, especially in this city, there are so many agencies who genuinely care about individuals living with HIV and make it their daily work to reach out and help them find their way.
Curtis is just one of the 34 million people in the world and one of the nearly 30,000 people right here in Chicago living with HIV every day. As David from the health department said, there has never been a better time to get tested for HIV than now. There are more locations to go to for testing, the process is quick and easy, and there are a variety of medications and support services available.
There is some information you need to know prior to visiting one of the healthcare facilities in the area and taking an HIV test. Our staff must first get informed consent, which includes 5 points and must be documented. The 5 points include: first, that testing is voluntary and you have the right to withdraw at any time. Second, the testing we will be doing is confidential. You have the right to anonymous testing, which is available at some locations throughout the city. Third, the test will be explained to you. Fourth, if your initial test comes back reactive, a confirmatory test is necessary and available to you to confirm infection. Fifth, referrals for medical care and social support services are available. Remember, you are not alone in facing HIV. These 5 points were made to help you understand the process and are required by state law. Remember that you can ask questions at any point during the testing process. I encourage you to say yes to getting tested.
I promise my grandson, Grandmama is gonna get straight. HIV/AIDS is not the end of the world. And for some of us, it's the beginning of a new life.
Congratulations. I'm so glad you have decided to be tested. From here, testing is quick and easy. Prior to testing, you will be asked some personal questions. Remember, everything is confidential, so please answer these as accurately as possible. Once you're done with the questions, it's time for the test. There are several ways to be tested for HIV: oral swabs, finger stick, or blood draws. Results are usually presented the day of testing and are more than 99% accurate. Once tested, you should receive your results within 15 to 20 minutes for oral swabs and finger sticking tests. Tests that involve blood draw may take longer. If your test is positive, you will have to take another test to be sure of the result, and the results may take longer to receive.
Now comes the time for the results. This may be a difficult time, so prior to being tested, you will want to think through a plan as to what to do next if you test positive the minute you walk out the door. I would recommend having a counselor, coach, or doctor available immediately to help you start living healthy with HIV. Yes, testing positive for HIV is a dramatic moment in your life, but remember, it is not a death sentence. There are lots of medicines and support to help you through this time.
I became a peer educator, and I talked to the guys in prison about HIV and AIDS and some of the STDs. I advise everyone to take the test. Your life is not over, okay, if you become HIV positive.
And part of the meditation was finding 5 things to be thankful for every day. It is my sincere hope to just help in a community service organization and helping somebody else find the same comfort and the same strength that I found to carry on.
If you test negative, you are likely not to be HIV positive. However, tests only detect antibodies for the virus, which are your body's reaction to the virus and not the virus itself. It's important to retest if you think you may have recently been exposed. Exposure means having unprotected sex with someone whose status is unknown to you or them, or if you have recently shared needles. If you fall into these groups, then you should be tested every 3 to 6 months.
Now let's talk about the healing part of HIV. There are many support services available for HIV positive people, such as case management, housing, transportation, mental health, and substance abuse services. Staff at any of the facilities throughout the city will help you get connected to these services. The key is to know for sure whether you're negative or positive.
Because HIV testing, regardless of this is your 100th time or this is your first time, nobody wants to do it and nobody likes to do it. But it's something that we do for our bodies, and it's something that we do for the community to make sure that I'm being safe with you, and I'm being safe with everyone else that I'm going to come in contact with.
I'm an HIV specialist. I provide education about STDs, HIV, and other diseases like tuberculosis and hepatitis C. We're living in a very diverse society. We got people from all walks of life. We got people from several countries with different values, different moral values. But HIV affects everybody equal. HIV today is not a death sentence. As long as we find it on time and you get into medication, the person can prolong their life for over 35 years or more.
Yeah, I've been taking tests every 6 months anyway, so I ain't had no problem taking one. And I always got to know my status. I had another friend that found out he had AIDS, and it's been 10 years, so don't wait.
Even if you test positive today, it doesn't mean that you were just positive today. It means that you've been positive, and this test is just helping us to get you into treatment today.
So if someone is positive, they immediately get connected with staff from that program, and that ranges from groups, connections to primary care doctors that can provide their ongoing follow-up care. So we're making that just regular part of the process when clients come into our clinic. They have primary care, and they also receive HIV testing, and along with the other, BMI, blood pressure checks, all of that.
Thank you for watching this video. We hope that you feel empowered to take the right steps in controlling your health. There are many tools and information available, but the decision is yours to take action in living with HIV. Remember, HIV testing is easy, confidential, and an important part to routine healthcare. Many lives can be saved. We just need to take the right steps. So please, don't hesitate to contact us for more information.
To be able to find an atmosphere where I could sit down and share everything about my daily life was one of the most freeing and wonderful things to happen to me.
They go to their primary care appointment or their psychiatry appointment. By the time the appointment's done, their results are done.
Please go to a treatment center. Get tested.
HIV doesn't just stop, and our exposure potential doesn't just stop one day. This is something that we have to continually do.